advise folks to go and check this out. It's called The Terrifying Reality of Long-Term Unemployment. And basically, it's a report about a study that came out by some economists that talked about how there's really two labor markets out there right now. If you're looking at unemployment and what's happening with reemployment, people that are unemployed more than 6 months, so people that are unemployed about 24 weeks or longer, have a tremendously more difficult time getting a job.
Well, you can imagine that, right? That gap in work history. I mean,
so you've got a lot going on there. A lot of I think there's a lot of just psychological things happening with an employer when they see that gap. I don't even think intentionally or consciously necessarily even think about, oh, well, this person must be lazy or this person mustn't be, their skills must be up to date. Certainly there probably are some that do think in those terms, but I think, it might just be in some cases more unconscious. But when you think about, and we had a great discussion at our last CMWIB, our Workforce Investment Board quarterly meeting with a presenter from the group that compiles these figures. That's the Bureau of Labor Statistics. More than a third of all people that are classified as unemployed have been unemployed longer than 26 weeks. The average duration of unemployment, the average, is over 30 weeks. So think about that.
Right. So there's a
lot.
And
think about the fact that the employment rate. Here's an interesting from the Atlantic study, which is article, which is based on that study. People with less work experience and relevant work experience to a job get called back for an interview at a higher rate than someone with relevant work experience and history who's been unemployed more than 6 months. So
that's like a huge that gap.
Yeah,
just that
think
long-term
about that. That's counterintuitive, right? I mean, so they're saying that's like the biggest factor right now, and so when you talk about the issue of unemployment, that's what you just saw. I know one of the things that we at the board have been working with folks at Workforce Central at is how do we address this problem?
I was just going to say, if you're a job seeker, facing this, what would you do?
There's obviously no easy answer. You got to keep plugging away. You got to keep putting the resumes out there. Keep networking. That's another big one, is keeping a set networking schedule. But one of the things that we've come up with that we think, it's not going to eliminate the problem by any means, but certainly can help meet some of that relevant recent history kind of employment gap, is to get people working as volunteering with local nonprofit organizations.
So kind of like an adult internship?
Yeah, exactly. Now, technically speaking, it's not. There's a big difference between an internship and a volunteership. Internship is tied to a training program, an educational program.
Right, you get credit of some sort.
You get credit. It's part of the training, and it would allow you to actually do that volunteer internship at a for-profit company. Whereas volunteership can happen with any nonprofit, municipal, as well, nonprofit groups. So, we're working to connect people. We're working with the United Way and many organizations in the area to help connect them with job seekers that are looking to volunteer while they're unemployed. It's a great opportunity for them to go in, to work with, it might be for a cause that they believe in. It might be for a group that they've worked with in the past that they like, or what have you. But they're able to really kind of develop, their skills, maybe a new skill, maybe practice older skills, stay up to date. The thinking behind it is that they're going to be going there and actually working on some really solid projects that will give them something they can point to an employer, to show the employer that they still have value to them, that they still have something to offer.
Right. And it shows that initiative too, that they're willing to go out there and volunteer.
Yeah, and think about all the other good things that are going to flow from the fact that they're regularly involved now with an organization and you mentioned in the workplace environment, networking, and all that.
Yeah, I was going to say, you mentioned networking, and I mean, you're basically selling yourself there. I mean, you get an opportunity to work on a project and really sell your skills.
And probably interact with many partners that organization has, to really kind of get the word out about what you're doing and what your skills are. So we're encouraging that. We've got a new program called Volunteer Connections.
Yeah, I was going to say, so if I was a web designer and I had been out of work for a while and I was looking to get involved with a volunteership like this, what would be the process like?
Well, certainly you'd want to go connect with the Career Center. And if you actually look online within their additional like program resources page, there's a section on Volunteer Connections.
Mm-hmm.
You go to that, watch a video. They got a pretty famous announcer to do a video about it, to narrate
James Earl
that.
Jones or
No, not James. It was actually me.
more popular.
No, I was talking about me.
Oh.
The edgy guy with the goatee. Yeah. So you watch the video. It explains.
Kind of walks you through the steps.
Walks you through the steps, and then from there you would meet with a staff person, and they would actually kind of help you pinpoint where some fits might be for you with organizations that have that need. So, like you said, that'd be a great opportunity for a web designer to work to help revamp or to create a website for a nonprofit organization that's out there. So again, meeting that gap or closing that gap in a resume and showing relevant recent experience and value to a potential employer.
Yeah, this seems to be helping on twofold. I mean, you're helping the job seeker, and you're also helping some of these nonprofit organizations with limited staff time that maybe have some projects.
Which in turn are helping your community, right? So
yeah,
it's like
volunteer connections.
It's a win-win, as we call it in the business. So we're excited about that program, and I know, speaking of the community and things going on in the community, we had a chance. We have kind of a multi-part interview with Derek Brindisi.
Yep.
Department of Health here in Worcester, who's going to talk to us about some of the initiatives that they've got going on. They've got a lot of interesting things happening there. So, Dr. Zukowski, are we ready with that to roll that interview?
Yes. First, I want to do this. This is WCUW 91.3 FM Community Radio serving Central Massachusetts and online at WCUW.
Hearing that voice, you should have narrated. He should have narrated the
fourth Wednesday of the month is the Working Lunch with Jeff Turgeon and Sean McGauley.
Hi, we're here with Derek Brindisi, the Director of Public Health for City of Worcester. Welcome to the show. Thanks for being on the Working Lunch.
Sure, thanks for having us.
So why don't you tell us a little bit about your department and your role with the city?
Yeah, great. So I'm the Director of Public Health for the City of Worcester. The Department of Public Health, I think, is one of those departments that the public doesn't typically recognize the work that they do, because a lot of the things that we focus on is really prevention-oriented. Mm-hmm. So we have staff that focus on a lot of different preventive type of activities. So we have individuals, public health nurses that work out in the community and try to focus on communicable disease, breaking the transmission of certain types of infectious diseases. We have staff that focus on public health emergency preparedness, and those individuals, they work in the community, they work with the hospitals and the health centers and the EMS providers, and they build capacity to respond to large-scale events such as snowstorms. The staff that focus on substance abuse, so we have two individuals actually, their work revolves around preventing tobacco use, trying to focus their energy on preventing individuals from overdosing as it relates to opiate overdoses, trying to prevent the use of underage drinking. And then a new grant we just received has a special focus on trying to prevent youth access to prescription drugs. We recognize over the course of our research the last couple of years that more youth are using prescription drugs than ever before.
So painkillers and
Percocets, Vicodins, those types of drugs. Individuals, youth in particular, are using those for recreational purposes. So that leads to other types of problems such as heroin use and such.
And the thinking, of course, is that a small investment of public resources can have a huge dividend when it comes to the prevention piece and preventing the costs later down the line. I mean, if someone is the cost to the system, never mind the human cost, but the cost to the system, if there's a flu virus or so, is huge, or a drug overdose or whatever, the cost of after the fact becomes a lot more expensive than trying to prevent in the first place.
Yeah, absolutely. And so they would some of the researchers would suggest that every dollar spent in prevention would save $5 in the short term in healthcare costs. In the long term, could save up to $10 in healthcare costs. So certainly, especially the Affordable Care Act today, there's been a large emphasis on doing prevention work and really focusing upstream and trying to identify some of the problem areas. So a lot of the work we do really focus on some of the social factors. So we try to engage other municipal departments like housing and public works and public safety and planning, because a lot of the things that they're doing has a direct impact on the work that we're doing and trying to prevent various types of illnesses and diseases downstream.
And I imagine too, I mean, there is a connection between workforce development and the economy and health and how that relates. I mean, they interact in a lot of different ways. Certainly if population is gainfully employed, I think it probably tends to lessen some of the challenges from a health perspective. More people have health insurance, for instance.
Yeah, I mean, that's probably the more logical example that, if people are employed, especially in the Commonwealth, where up to 95 to 98% of the population has some type of health insurance, you would assume that if you're employed, you have coverage, you have access to a primary care physician, and therefore you should have better health outcomes. But then there's also the opposite of that spectrum, is that when an individual is unemployed, what are all the other things, beyond not having health insurance, do they occurs? And so some of those would be like depression, starting to abuse various types of drugs and alcohol, all those other co-occurring issues.
At the Career Center, sometimes we see, and with the youth programs that we fund too, I mean, we see people get on that downward spiral, right? They have a hard time finding a job. They get more depressed. They might abuse drugs more, and just kind of that vicious cycle of depression. And so, sometimes, a lot of times, it's that job, though, might be a critical component to breaking that cycle. And especially if you can do it early on, and speaking about prevention. So we're here with Derek Brindisi, the Director of Public Health, City of Worcester. And Derek, I know you have a lot of interesting and important projects going on. Do you want to talk about some of the things that you got going on?
Yeah, sure. So our department, again, we're a very small department, but we're very lean and efficient in what we do. And one new aspect of our work is that we're not just a city department any longer. We're actually a regional health department. We were fortunate enough to receive a $325,000 grant from the State Department of Public Health to regionalize municipal public health services, which again, with the Patrick Murray administration, they've been really pushing regionalization of municipal services. So we're fortunate to be a part of that. And so we're focusing a lot of our energy now in the towns of Millbury, Shrewsbury, Holden, Leicester, and West Boylston. So we're working with those boards of health. We're listening to the needs of those communities and those residents and trying to adjust our services to meet those needs and those demands within each one of those communities.
And does that help to leverage the public funding that goes into these programs? You've got, instead of having small individual communities, trying to do it all on their own, is there like an economy of scale that develops with that?
Yeah, I mean, that's the whole notion, that there is an economy of scale, especially some of the smaller communities. They don't really have an infrastructure. They have limited dollars, and typically those limited dollars, when a municipal budget, they go oftentimes to education, public safety, and public health kind of gets put aside. So they focus more of their energy on meeting the state mandated services. And so by brokering these agreements and working with these towns, they pay into the system. So they use the limited dollars that they have, and they contribute those dollars to the city. And then we're able then to expand our services. So for very similar dollars that they've always paid for in the past for public health, they've actually almost doubled the types of services that they would not ordinarily have had in the past.
Sure, and I imagine too, from just a pure health perspective, I mean, people are very mobile. They often work in Worcester or commute from Millbury or vice versa from the communities outside. So, unfortunately, a disease, a disaster, those things don't, stop at the city border, right? So.
Yeah, absolutely. I mean, and we've always, Dr. Morse, the former Commissioner of Public Health, would always say that a disease has no boundaries. So, we dealt with pandemic H1N1 in 2009, 2010 flu season, and they didn't stop here. So the work that we would do in the city of Worcester would translate into those communities as well. So we're excited about that work because certainly it helps us and it helps the communities, and it actually raises the level of type of service that all residents should be receiving as it relates to local public health.
Well, and that's
Hi, we're here with
it's great
Derek.
to hear
This is,
from Derek
Oh,
and
there
all
he is
that he's got
again.
going on. Yeah, yeah. So we're happy that that he was able to come on and talk about that
Yeah.
and all that they've got going on. And Sean, I know, speaking of of things, you've got
Yes, I've got some
you've
things
got
here.
some things as well.
So,
it's mail time.
mail time. So as you know, we get tons of emails from our listeners and our viewers. Lots of times, different questions about the Career Center and the work we do. Again,
Including
our
some of your, I know you're recently
fan
married.
fan mail.
And I think Sarah's the name of your wife. And I think she's been a little jealous of some of the romantically tinged
Yeah, she's having-
emails you've been getting lately.
She's having a lot of trouble with the stardom of the show.
It's trouble.
When you go out to
It's a
eat,
high
people
job.
want autographs, and it's just.
It's the price of fame, my friend. All right, so why don't you share with us some today's mailbag question?
So today we've got an email from Stan in Milford, and Stan writes, "Hey guys, I was wondering if there is internet access at the Career Center." So I know the answer to this one. There is, but I wanted to go one step above for Stan and talk to the staff at the Career
Which is
Center.
what you do, you know.
That's just my
a
style.
lot of guys would just you could have just given like a
Yeah,
one-word
yeah,
answer.
Stan,
Yes.
yeah. Stan.
Yes, Dan, we do.
Next
but
email.
you go above and beyond. You're gonna give him probably more information than that.
I've got more information. So I talked to Wendy Gould, who's the I'm not sure of her exact title, but she's one of the staff there at the Career Center. and
Resource
she-
room coordinator, I think. Yeah.
Yeah, I wasn't sure if it was
She does a great
coordinator,
job
but
there. Yeah.
Awesome job. And so she put a list together of all the stuff that
She's also involved. We mentioned earlier the Volunteer Connections program. She's the point person for that program that people meet with.
she does it all.
She does it all.
And a great job. So they do have internet access. They've got 10 computers there where you can conduct your job search activity, apply for different things.
Yeah.
You can also use their resume templates that they have. They have a design where you can work there. You can also print it on like the nice thick cardstock, the resume paper. You can print that there. You can fax out resumes and you can fax out your cover letters. And they'll actually stamp and mail 3 job search
Wow.
things for you.
So yeah, I
and
know
you're
a lot of
probably
it is
wondering-
done electronically these days. But if you're still,
you can
and
send the
but
hard
there are a lot of smaller
Yeah, I've seen-
companies that are requesting.
Yeah, some
That, yeah.
you still do need to mail out, and you're probably wondering, how much do all these cost? Like, how much do I have to cost to get into the resource room? Any idea?
Oh,
Like a lot.
per visit. Are we talking like a monthly pass?
You tell me.
$20.
It's free, Jeff.
What?
It's free. All those services are free.
But you could pay $20 if you want to.
Yeah, make the checkout to Sean McGauley and send it.
That's